We live in a deeply broken, not just health system, but political system in the US, where health is a privilege and a commodity. When COVID hit, we saw how horrifically inequitable the impact it was on communities of color, on poor and working class Americans. There was a need and an opportunity coming out of this acute crisis to push harder and more ambitiously and more imaginatively on rebuilding and redesigning these systems. We embed teams with local partners in 7 communities in the US and help accompany and run alongside those partners to build programming, to build policy, and to implement it to improve health outcomes and health access across the country.
In Immokalee, there is a chronic lack of access to social services, particularly healthcare. And on top of that, 50% of people here are migrant. Our goal is to find ways to bring available services closer to our vulnerable communities. Teaming up with diverse partners, we were able to put together a very robust response centered around community health workers. They know better than us about the real issues the community is dealing with and how to best address them. So we hope to push further to expand that infrastructure throughout the region and essentially integrate it in the health system for the long run.
One of the most important things we've done is create a collaborative infrastructure that kind of meets the needs of folks who've not yet seen themselves in public health. We've built a virtual learning community, a place where everyone could come, everyone could find a seat at the table, pick up updates on COVID, but also start talking about health inequity based on race, based on the history of segregation. And week after week, we listen to what people want to learn, and we respond with the best experts and content we can put back. There are things that community-based organizations can do that healthcare can't do, that public health can't do. We gave them a place to connect, and we gave them an ear that was willing to listen and then respond with resources they need.
New Bedford is a diverse community. It's a community that's been fighting for its way for a long time. We recognize that those communities that were being hardest hit through COVID had the fewest amount of resources, and so we had to really build that capacity, which we did with the help and support of Partners in Health. And as a result, we've added a number of community health workers or community outreach workers to really work closely with those populations that have been marginalized. Yeah, it's important for the health department to connect with grassroots organizations because they're at the core. And that's why we engage with community partners, and that's why we make sure that we have cultural competency in the work that we do.
Del Departamento de Salud no es específicamente de una clínica ni privada ni pública. Eso es lo que yo les digo.
This work is a glimpse into the future. We are strongest when everyone is able to pitch in and be a part of the solution. You know, we really want to seek that innate power that's in every community.
This is our chance to make community health work better in the United States. The time is right. People recognize the problem. There is money out there. And investing in community health work that makes health systems better, that implements and delivers and provides care better is absolutely crucial.
It really takes a whole movement and ecosystem pulling together to address these really thorny and deeply rooted health injustices that we're trying to address. We found it's really critical that we're not just embedded with the health department or just working with amazing grassroots community partners, but that we're able to bring together that diverse set of partners to do shared work and to build shared power.